Hello, everybody, and welcome to our Lift Up Women in Life Sciences live broadcast. We are back today, and I also would love to acknowledge that it is a public holiday in the United States to commemorate Juneteenth. So, for those of you that are dialing in today from the US, we're very grateful to have you part of our broadcast today. And today we're here to talk about women's health. It's such an important topic. We have been discussing this within our community group and within the industry for quite a few months now. We've gathered some really insightful statistics. Some of that we've been actually sharing on our LinkedIn Lift Up page and Fraser Dove page for those of you that have not yet seen it. But we are really excited, the key speakers and I, to dive into this topic because the importance of women's health is huge, and it is so multifaceted, from not only affecting individual women, but also families, communities, and just society as a whole. And I know that the three girls, Carmen, Erica, and Martha, have got such great insights around disease prevention, the scientific research side, economic impact as well, that we're really going to try and cover off as much as we can in the next sort of 45 minutes to 1 hour. So thank you so much for joining us. And for those of you that are completely and utterly new to Lift Up and joining these broadcasts, this is, I think, is the 23rd one that I've now done. So we launched this in September 2022. Our mission here within Lift Up is all around connecting, inspiring, and championing women, right from academia all the way through to C-suite within the life sciences space. We've had podcasts, we've had conferences, we've had journey blogs, kind of all snowball off the back of these broadcasts as well. But we've now had over 50,000 global views, and I think around 45 key speakers that have joined on this journey. So thank you to everybody that's been a part of it. And for the regulars that are perhaps joining us back today, please actually say hello within the comments. So again, if you're new, add into the comments where you're dialing in from. We get a real global reach, which is always fantastic to see what kind of areas as well that you're working within. So pop your name, where you're dialing in from, and say hello to the network. It's all about building these relationships. And also throughout the live broadcast, towards the second half, we always do an interactive kind of Q&A session with the key speakers. So what we always encourage those of you to do is put a Q in front of any question that you might have within the comments to make it a little bit easier for me to navigate. We can get anywhere between 50 and 100 comments on a live. So please pop in your questions and don't be shy. So I'm going to do a little bit of a intro into myself, and then I'm going to bring in our key speakers that I know are waiting very patiently in the background. But I'm Louise Williams. I've been in staffing for about 20 years now, life sciences within 10 years, 2014. Hugely passionate about life sciences. Can't imagine being in any other industry. My background started in the clinical medical world. I'm now the operations director, recently promoted into MD here within Fraser Dove International, which is the life sciences executive search consultancy. And it was really FDI and the women internally that have acted as ambassadors over the last 2 years that kind of launched this Lift Up community group, leveraging off all the wonderful relationships we've got with women within the space to try and connect, inspire, and champion those other women within our industry. Other than that, I'm a mum. I've got 2 children. I've got an 8-year-old daughter and a 4-year-old boy that keep me super busy outside of work. And yeah, that's a little bit about me. So really excited to kick this off today. And I'm going to bring Martha into the screen. So if you wouldn't mind doing an introduction to the audience for us.
Thank you, Louise. Thank you so much for inviting me today and to have the opportunity to share a few insights of what we're doing to support women's health. It's a topic that is very, very close to my heart for sure. So a little bit about me. I have an international journey that spans over 20 years across multiple areas within human resources, consulting, big pharma, and more recently, mid-size life sciences companies. And I have supported many areas across the business: commercial, manufacturing, BD, R&D. I'm very passionate about science and data-driven decision-making at the executive level. So I think that's what I enjoy so much, partnering with my R&D clients. And that's what I have been doing for the last 10 years or so. I have worked and lived in 5 countries, in Latin America, Europe, in the United States, and I have also led global teams, which have really allowed me to appreciate the value of cultural differences and diverse perspectives and what they bring to the table. During my career, I have led complex cross-functional integrations with Sharing Plow back in the day in Latin America, the Cubis acquisition in Europe, and more recently, one of the major spin-offs in pharma from Merck & Co. to what is now Organon, where I was responsible to lead the R&D HR strategy. So I am a proud mother of 3 daughters, 3 girls. And so this opportunity, when that was presented to me, I thought, if I can contribute this big with making a better world for girls and women, I'm in. And that's what I have been doing over the last 3 years. Building a company of this size and footprint is extremely hard. It hasn't been easy, way more challenging than we ever anticipated, but also very, very rewarding. So again, thank you for having me and for sharing the panel with this amazing woman today.
Thank you so much, Martha, and it's an absolute pleasure. And I know exactly what I've got a boy and a girl, and you kind of want to know that them growing up, they've got almost access to the equal opportunities, and it's great to have you a part of this broadcast. So thank you. And we've got Erica. Love for you to do an introduction to the audience too.
Yes, hello everyone. So glad and happy to be here today. My name is Erica Paine. I work for Chiesi in the US. I lead our value and market access, which includes our health equity strategy. I have been in the industry for over 20 years. My background is mostly in the commercial space. I'm most proud of the opportunity I've had here at Chiesi to help start our DE&I efforts. And I really spend a lot of time thinking about how I can apply the learnings from my commercial career to help us all get behind the real business impact of diversity, equity, and inclusion work, including women's progression, which is something that I'm very proud of we've done here at Chiesi, looking at equal pay initiatives, and not only looking at them, but actually beating our targets to get there. So it's a great place to be. I've been a single mom of 3 boys for a long time. They're now young men who are wonderful human beings. And I'm just proud to be here today with all of you.
Thank you. Thank you so much, Erica. And your background's truly inspiring. And we've also got Carmen as well from Chiesi. So I know that you both work for Chiesi as an organization. So it's great to have you both here as colleagues as well, and ambassadors of what we're doing here within Lift Up. So Carmen, would you also do an introduction to the audience?
Sure, Louise, and thank you so much for having me. I'm so happy to be part of this conversation today. I'm a physician, endocrinologist by training. I started, my career in the healthcare, taking care of patients, and then after a few years, I joined the industry. And I've always worked in the medical affairs, departments and group, and now I'm leading the global medical affairs at Chiesi. Working a little bit internationally as well, from Europe to the United States, and trying to connect also different culture and different approaches. I'm a member of the Diversity and Inclusion Committee at Chiesi, so I'm very proud that many initiatives are being developed in the last few years in terms of women progression. And of course, my scientific background put me in a position to try to make also connections between, the women's progression, the gender disparities, and the more science part of the discussion. So I'm very happy to be here, Louise, and looking forward to our discussion. I also have 3 kids, just to add, 2 boys and a girl, and we are on the same situation here. Thank you.
Yeah, thank you so much, Carmen, as well. And we were briefly talking actually as a group, weren't we, recently? And I didn't realize Chiesi's actually been, did you say, was it nearly 90 years, third generation? And I just thought I'd give that a bit of a shout out actually, because I think when I asked you around, the initiatives, DE&I, and creating these changes, it is so important that you're having that support from your leadership and from the people, the powers that be, so to speak. And I think you both spoke obviously very highly of that support that's allowed you to create these initiatives and groups and programs internally. So Sorry, just thought do a bit of a shout out on that one. It just came to mind. But yeah, lovely, Carmen. Thank you very much for joining us today. I'm going to dive into the audience because we've got some great comments coming through. Those of you that are maybe dialed in a little bit late, say hello, pop where you're dialing in from into the comments. If you've got some questions, that you want to throw out there for the key speakers today, pop a Q in front of your questions into the comments. But we've got Lisa. Thank you for joining us, Lisa. Lisa, a new viewer from Chiesi. I'm sure you ladies know her. We've got Lee for Children's Fight of Hope. Love that. From the US. We've got Ian here joining us from Newbury. Thanks, Ian. If you've come up as a LinkedIn user, you might just have your privacy settings set to hide. But thank you for joining us today. We've got people all over the place. We've got Donna. Thanks, Donna, for joining us from Florida. We've got another contact here, Laura from Chiesi. I can't actually get through them all. There's a lot. Another one here from Chiesi. So you've got great support network. Absolutely love that. We've got Andrew, our CCO here, who's joining from Southampton. We've got quite an influx from Florida. Nikki from Florida. So yeah, thank you so much for dialing in. Keep commenting. That's what this network's all about, and community build. But we're going to dive into a question, and one that we thought as a group would be a great one to kick off with, which let's just have a bit of a pause and a definition of actually what does women's health mean, and what does that term perhaps mean to you individually, because it is so multifaceted. It is such a broad topic. So I'll come to you, Martha, with this question first.
Yes, thank you. So I think women's health to me represents a huge opportunity, but also a huge responsibility. So when I think about women's health, the narrow definition is sexual and reproductive health. And we know that sexual, reproductive, maternal health, etc., only account for 5% of the women's health burden. More than half of the women's health burden really reflects conditions that affect women disproportionately or differently. And most of that is impacting women in their working years, which is, of course, devastating. Mm-hmm. So think about migraine, for example. I'm not an expert on migraine, but these are the few data points that are just alarming. Migraine is the second cause of year sleep with disability in the world. The first cause of year sleep with disability in women between 15 and 49 years old is 3 times more common in women than men, but it also affects women over 30% of women over their lifetime. Who knew, right? That this is something, again, and this is the majority. We see that, and Carmen, I'm sure we'll talk about this, in many disease areas. So to me, women's health is a huge opportunity. It has been quantified already by McKinsey Health Institute around the potential economic growth is $1 trillion, I believe, by 2040 is huge. And so it is not only the right thing to do and the right time to address this, but also it has a huge economic benefit. And when I say it's a huge responsibility, as an HR professional in this particular industry, seeing discussions around the importance of increasing women representation in clinical trials, to see that gender parity, et cetera, are gaining momentum, all of that is encouraging, but I think actions need to match the discussion. So.
Yeah, I mean, that's just a snippet, but such an alarming statistic as well. So thank you for sharing that, Martha. And Erica, I'll come to you with the same question.
Yeah, it is multifaceted. And I think today's a really important day for us to acknowledge some of the intersections, as we commemorate the end of slavery in the US on Juneteenth. I think a lot of us have heard in the news, I'm glad it's getting the attention that it deserves, just the Black maternal health disparities that exist, and those and others that relate not to our reproductive organs are really rooted in the fallacies of racism that were perpetuated. Enslaved women were experimented on, were subjects in the early ages of OBGYN therapy. And the interests of the slave owners were really looked as more important than the women. So, and then you even had one of the things about women's health that first really got me, hit me emotionally, was the story of Henrietta Lacks. And in 1951, her cancer cells were stolen at Johns Hopkins. They led to a lot of really great innovations in the world of cancer treatment. And she didn't even know that they were taken. And it recently her family has been given some acknowledgement of those. But those sort of things have really served to remove trust within the medical system. And I think that's something that truly perpetuates not only those intersections for Black women, but also for others. You know, self-reports of painful symptoms are overlooked or minimized, and that can lead to misdiagnosis, undiagnosis, and unfortunately death. And so, you know, it is multifaceted. And I just really think it's important to acknowledge that today.
Yeah, I absolutely agree. And I think that there's some things that you've touched on there that we're going to dive into in a little bit more depth as to, you know, why do we actually feel that some of these things are happening, and what kind of things can we hope to change for the future. But Carmen, I'll just come to you with the same question. You know, what's your kind of thoughts and definition of women's health, broadly speaking?
Thank you, Louise. This is such an important question because actually there is not an aligned definition of women's health. And I want to go back to what Martha said about, you know, generally when we talk about women's health, we focus on conditions that are specific of women, right? Female condition and reproductive health, pregnancy, menopause, etc. But we must also have a little bit an expanded lenses and look at also the overall impact and the overall disease that can impact the overall population, because the diseases that are common both in women and men can affect women differently and can impact women differently. So I think when we talk about women's health, we need to consider, you know, the different impact that diseases can have, and also, you know, how they can manifest with symptoms that can be different, that we sometimes call atypical, but we call atypical just because there were not enough studied in women. And then the second point there are also diseases that are disproportionately higher in women, but they affect all sexes, also men. And then finally, I think we should focus also on bias, implicit bias, unconscious bias in healthcare system that can affect women. So I think overall the lenses that we should apply is broader, and I think it's important to remind this when we talk about this, and of course not to forget that it's not just physical health, but also emotional health, because these are very much interconnected. So as you said, Louise, is multifaceted, is complex. There may be several reasons, but if we start with the broader lenses, maybe we can have also broader conversation on this.
Yeah, and I think there are pockets in which we can hopefully have the time to go a little bit more niche and down the rabbit hole with. But I do think that for me, this feels a little bit like we want to use this platform right now as an opportunity to try and maybe help inspire those that are not quite sure around what are all these different multifaceted areas within women's health, and actually try to take the blinkered routes off. And where we'd often just think down the reproductive route, we don't often look back and then think, but what are the implications? What are the knock-on effects by not having, you know, a diverse trial participants in clinical studies is actually then doing 3 stages down the line, even to a workplace economic, you know, growth perspective for a business. It's huge, isn't it? So I think what we have found as talking as a group, and actually in the community space in the last couple of months, is there has been some recent statistics that have been thrown out there by McKinsey, by a number of, you know, well-known governing websites and bodies that have, you know, pushed out some stats that are actually really, really alarming. And we thought what we can do is maybe share some of these and then get our thoughts as to why do we feel this is happening and what we could do to potentially change. And, you know, this is as an individual or a business or, you know, a group. The first one that came up was women live longer than men but spend more of their life in poor health. And that's a crazy statistic. I mean, I do think that if you ask generally people, they'll say, oh, women live longer, but the kind of living in poor health is quite sad. So what does this, when you hear this statement, Martha, what comes to mind for you? Why do you think this is?
So the first thing that comes to mind is thinking about the multiplying impact of that situation in families, countries, the workplace, etc. Right? So I think, and my colleagues, I'm sure, will dig into this. There are so many issues that are behind this. We don't have enough science. We don't have enough women representation in clinical trials, and then it just limits our understanding of what those differences lead, and then that leads to ineffective treatment. That's a problem. We know we don't, all of this data burden information is limited, is probably underestimated, which is even worse. We know on the care delivery side, there are barriers to care, there are biases in the system. Even if you think about, menopause or pain, we have been socialized to kind of understand that that's natural, that's menstrual pain, for example, is okay to have it. And so all of that then leads to maybe women not even seeking help at the right time and getting the treatment that they deserve. The investment is clearly underestimated in this space. One thing that I think about is we need to figure out a way to start educating early on patients, women, girls from the beginning, and then also healthcare professionals to really, hopefully changes, because it's not only alarming, but we need, as women, find our voices earlier and advocate more for our health. So that's what comes to mind.
Yeah, thank you, Martha. And what are your thoughts with that, Erica?
Well, yeah, I wanted to build on something she said about what I think about is the way we've normalized not feeling well. Whether that's because we are embarrassed to talk about it, because hormones are often a punchline, even in perpetually have been in the workplace. Something like, I can remember being a sales rep a long time ago and knowing that if I just told my male boss that I was having women issues, he would just cover his ears and say, do whatever you need to do, and that just kind of perpetuates this idea that we don't talk about these things. And so if we don't talk about them with each other, then do we feel that we can talk about them to our healthcare providers, or even recognize that there's something not normal about the way that I'm feeling, and then having the time to be able to go see a doctor when you have a lot of different things on your plate, especially as working women and mothers. And then also there are social determinants of health that play into this that can't be ignored. Access to healthcare is not equal. And so when that becomes perpetuated for women, it just kind of snowballs into the place where we are now, where the economic impact of these things are ginormous. And thankfully, we're at a time where we're shining a light on this. And I know together we can all make a difference, even by just removing the stigma. Is something everyone can do, and talking more about it.
Yeah, I agree. And I do think, whilst there is a significant way to still go, and I think it might have been Martha mentioned some late statistics in years to come, it's going to take X amount of years to change, which is quite a scary thought, but, marginal gains and all. But I do feel that, in the last 2 to 3 years, probably post-COVID, and I don't know whether it's a combination of DE&I and belonging becoming more of a talked about and more internal initiatives being created. But it does just generally feel that women are starting to feel a bit more comfortable in talking about, I ran a menopause live broadcast in February, and it was great to still hear a good selection of individuals that felt more comfortable talking about that, or some initiatives being created. Still a lot of work to do, but I do feel like it's being talked about more now than it was a decade ago or 2 decades ago. What are your thoughts with this one, Carmen?
Yeah, Louise, I agree with what you are saying. I think there is momentum. We are not there yet, but momentum in terms of discussion regarding these topics, and we definitely can leverage on that in terms of increasing awareness and increasing the discussion also among different stakeholders, among different players, because I think it is going to be a combined effort. It's not to be only from from the healthcare providers, the pharma, the regulators, etc. And going back to the report that was published in January by McKinsey, Valentina Sartori and other authors, I think something that stuck in my head a little bit was the concept that, yes, we live longer, and we generally talk about lifespan, right? But now we are talking about health span, and so which means not only the challenge is not only adding years to life, but also adding life to years.
Love that.
And this is incredible, because if you think about 25% in that report, it is described that 25% women, the women that take, that spend their time 25% more in poor health in relation to men is already a stunning statistics. I mean, it means, and this is almost 50% in their working years. So it's already give you an idea of the impact, 360 degrees in terms of society, in terms of workforce, etc. So I think definitely the complexity of element, I mean, is cultural, is social determinants of health. There are biologic differences, epigenetic differences. So there are many factors that together impact these stunning statistics, in my view.
Yeah, I think that's a great summary, and I love the way you worded that health span. I mean, it's absolutely true. It's the quality of life, isn't it, that people want to lead, which is so important. We've touched on a few things here, and we're going to dive down to some of them. I think one of you spoke about pain bias as a term. Women, especially Black women, are more likely to experience pain bias where a health professional overlooks or ignores the level of pain they feel. I mean, that's a pretty shocking stat that's come out literally about 4 weeks or so ago. You mentioned around, I think it was Erica, did you mention around the pain bias? Do you want to elaborate on why you think that this is happening?
Well, as I said, it goes back to a lot of the fallacies that around racism, specifically for Black women, around pain intolerance, or even crazy to think this inability to feel pain.
Yeah.
And then I think that it perpetuates in when self-reports of painful symptoms are ignored. I shared with you guys yesterday, I recently had 2 different physicians say to me, "Is it bearable?" As I was talking about like the problems I was having that they couldn't help me fix. And so if it's bearable, then just go about your life. And I think that is not something that's uncommon for women.
Yeah.
There are some statistics that show that those symptoms being overlooked or minimized are directly related to the Black maternal health crisis that we have in the U.S. And then it also perpetuates itself in painful lives that women live, that again, it's like, well, you just get used to it. And somebody says to you, well, can you bear it, until you tell somebody new the story and they can't believe this is the life that you live.
Yeah, and sometimes at the point where they can't bear with it anymore, it's mental health wise, that can sometimes be too late.
Yep.
It's kind of like it can be that one extreme to the other. It's shocking, really. And Martha, what are your thoughts with this one?
Yeah, I think it has been very well said in terms of all these gender stereotypes, but also all these additional stereotypes that Black women face and how that leads to. I think, again, I don't know that's the magic answer, but I really believe that giving the women voices to advocate for themselves is so key. I was recently having, sharing the journey with a colleague that is Black, African American, and she knows by being in this industry and educated on these topics that this is not right. And she's almost about giving up, understanding that she's experienced so many symptoms, being, moved around physicians. And we were having a conversation. It's like, do you realize that you cannot give up? This is your life. This is your health. You're not getting the answers that you need. You need to keep seeking them and demand for the right input. And so it's almost, it's devastating, but I agree. So the impact of mental health is not only in productivity, which is probably the least of the problems here, and on the entire family also being impacted with it. So I think, again, the whole education, the whole point of us, making sure that we are finding our voices and advocating for ourselves and for each other.
Yeah,
So,
and I think this one, I mean, Carmen, unless there's anything to add, I just suddenly thought that it kind of flows through to this kind of, it takes the average sufferer 8 years to be diagnosed with endometritis, and the number of women who have died during pregnancy is the highest it's been in 20 years. I mean, that is shocking, isn't it, really, based on, our resources, the funds and, the scientific advancements we're in now versus we were 50 years ago. But, that's from a duration of time as well. 8 years is a very long time. And just something you said then, Martha, around, that individual being, almost pulled pillar to post by different physicians and it taking so long to sometimes diagnose. And Carmen, something you previously said to me, you can maybe elaborate on a little bit, was around the trial participants, the diversity in these kind of clinical studies and trials. And you had a story yesterday around an individual, a white male, I think it was, where you were typically saying that, so from a clinical trial perspective, if there isn't diversity there within the studies, then we can't expect to get the same end result or the same, result from treatment. So I don't know whether you want to elaborate a little bit on this, because it's a pretty
Yeah.
shocking diagnostic, this, isn't it?
Absolutely. I think this is very relevant. And I mean, we talk about bias here, but also we talk about misdiagnosis and late diagnosis as well, which impact a lot on health outcomes. And I think, historically, there has been in several areas of medicine, there has been the assumption that, men and women, more or less, will behave the same, right? In terms of, especially when, you study a disease or you study a treatment to get to the market as a medicine. But in reality, there are differences, as we were talking about before. So unless you study these different and unless you represent equally and understand, response to treatment, efficacy, safety, but also patterns of diseases, it is very difficult that you can have, a pictures that represent the overall population and the population, the society that will perhaps take that medicine. So it's so important to have equal representation. I go back to the point of representation because I think it's definitely representation in clinical trials. Regulators now are, focusing a lot, increasing the attention on the importance of representing, in equal way men and women. And of course, they are increasing also their guidance, both the FDA and the EMA on diversity in general, right? But I think it is very relevant that we study in a gender specific way and we analyze data in a gender specific way, because we know that this difference then lead to misdiagnosis and late diagnosis, etc. So I think another point, Louise, if you allow me, is not just have more women in clinical trials, enrolled in clinical trials, but also have more women involved in the process of clinical development and designing clinical trials. We are very fortunate in Chiesi because Chiesi is a company with a lot of focus on R&D, and we have 65% of our researchers that are females. But I think the progression of research from very early stage to preclinical and clinical development and then post-marketing needs representation of women to foster innovation and to foster also the perspective of female researchers. So I want to spend these 2 words also on this point. Thank you.
No, you're absolutely spot on, and this is where getting girls excited in science from an early stage. I was talking to another professional in life sciences last week, who was just hugely passionate around bringing the academia and the education piece and the private life sciences industry. That connection needs to increase, and we need to be getting more girls at school from a young age excited about science, women into STEM, more women studying degrees or being medical professions, physicians. Carmen, I know you're a physician, but it's like you said, it's trying to diversify not just the actual trial participants, it's the people that design the clinical studies. We need a diversity in those that are creating it. And actually, I think something Andrew's popped on here. Thank you. Diversity in trials and in boardrooms, so both from an academia, from a lab, and from a commercial business perspective is absolutely key, to deliver from a patient centricity perspective. So thank you for popping that in there. This kind of, we touched on mental health, briefly. It's another banner underneath women's health, isn't it? The impact it can have on families, society, your own mental health. But between productivity loss and the cost of treatment, the global economic impact of menopause is estimated to now be 150 billion annually. I think 10 billion in the UK alone. I think, Martha, you had some stats from a US perspective, but that is astronomical. And I think it's something like 531,000 a year on sickness. And when we're talking, menopause, and the reason why I mentioned mental health is because I think broadening from just menopause, when we're looking at women's health, we're looking at perimenopause, menopause, pregnancy, postpartum, and anxiety and stress and depression that can sometimes lead off the back of those biological changes, or having, children. And that has such an impact on a workplace, from perhaps not being as present at work. So that impacts economic growth, and it's just like a spider web, isn't it? But what are your thoughts with this one, Martha? I'll come to you. I think you
Yes.
actually passed me this statistic.
Well, they're not pleasant to read, and we need to change this. But there's a way. So Organon, is committed to listen to women, and that starts. We believe we have the commitment to start internally in doing the same. So we believe by listening employees, you can really find a lot of things. And it's interesting on the menopause topic that you were touching on. We actually listening to the women and the symptoms that they were experiencing in perimenopause and menopause, we realized that we needed to do something. So we actually expanded the time under our kind of global care leave policy or whatever, to kind of capture all of the symptoms that women are experiencing that can be really debilitating and impacting them, and giving them time to take just because of this. It's progressive, is good, is the right thing to do. We know menopause comes as a time when many women career are reaching that inflection point. They're taking more senior management roles, more executive leadership roles. So creating policies to accommodate them is crucial. And it's working. And we know that. I'm really pleased to see really that companies are leaning into more progressive benefits and leaving behind these restrictive, policies, because we need to evolve and accommodate these conditions, and that's part of, helping these numbers to change.
Yes, yeah, I love that, and it's great, because it's these small steps that business by business, it will start driving the global change. So I think that's really, really important. Anything to add with this, Erica, from a kind of mental health or from a menopause perspective?
Yeah, I like what Martha said about listening to employees, and I'm very proud of my colleagues at Chiesi who have started our Women's Initiative Network. It is a group of women and men allies who are in the U.S. Oh, I think 136. We have a lot, and they have been a voice for what we need. They have a wellness group that they talk about. So they've empowered individuals to say, hey, single parents need some support. And also we have changed our pregnancy and birth leave policies to better accommodate and leave space for employees to be human beings who feel things, and give opportunities for us to talk to each other about those things. I think is starting to make a real difference for us, and it really starts to take away the stigma, empowers women to stand up for themselves and for others, and also helps men be allies and have the right words and the right ideas to push forward in order to help make change.
Yeah, the right words is something that somebody's actually just commented on, which I'll pop in just a minute. But is there, Carmen, any thoughts with you following this?
Yeah, maybe taking a different angle,
Yeah.
we should also consider that during the lifespan and with the different changes in women's, so the pregnancies and the various phases, some diseases may exacerbate, may become more prevalent. For example, asthma is a disease that typically is less prevalent before puberty, but then after puberty becomes more prevalent in women than in men, and becomes also more serious with a higher hospitalization rate, etc. So this is just to say that we should consider the overall picture, and saying that sometimes the combination of more than one condition, considering the different changes that women face throughout the life, can really have an impact on both mental health and also loss of productivity. So putting together things, I think, is important to see this in a bigger perspective as well.
Yeah, very well said. Thank you, Carmen. Diving back in here, I think there was Lisa just said, for many conditions, there isn't even a vocabulary to use to advocate for yourself. For example, menopause, how do we develop the vocabulary to talk about women's health? So you just mentioned vocabulary, Erica, and it kind of just connected itself. What are your thoughts with this, comment from Lisa?
Yeah, I think so. Lisa, I have to give her a shout out. She's also on our global diversity and inclusion team with Carmen and I. So she's really passionate about this topic and an advocate for rare disease and women's health. I think it is just about we can actually make a difference by talking about it amongst ourselves, which is encouraging for me, because this is such a huge issue. And you think, how do you even start? Well, it's talking about it amongst ourselves.
Yeah.
And those, like specifically as she's saying around menopause, we've kind of opened up this conversation at Chiesi, and it's because of this women's network that has started. And we've just started to organically share information about, did you know this, or did you hear this, or go read this. And so it's that way that I think that can be a good start from a groundswell perspective. And I think, from an organizational perspective, we can listen to our employees and provide that those opportunities for vocabulary that can help them.
I think that's a great shout, Erica. I think the place to start, isn't it then, Lisa, is to kind of, even if it's baby steps and you're finding a small group, a community group that may be, like a lift up, where you're not actually, closely connected to lots of different people that you want to share something with, or whether it is a very small intimate group with women internally in the business that you're starting to communicate with. But I think it is a hard thing to do, because I'm going to throw something out there that actually very few people know this about me, literally my mum and somebody else. But I've had 2 children now, and after having 2 children and after having Jasper, who's 4, I cannot drive on the motorway. I actually struggle to drive on the motorway now. I get anxiety being on the motorway when I never, ever had a problem driving on the motorway. In fact, growing up, I was the one that was always like, no, I'll bomb it down to Devon, or I'll bomb it, to wherever it was in our UK. So, and for quite a long time, I almost struggled saying that, because I kind of saw it as a bit of a weakness, or like, what's wrong with me? Like, what is seriously why? I mean, it was a combination, I think, of having Jasper, my son, through COVID, and we were, in lockdown for a long period of time, and being heavily pregnant and all that drama. I kind of didn't drive for 9-10 months. So I think that probably had a bit of a, and even now I'm like, it frustrates me that I can't, and I probably do need to do something about it. But the fact that actually now I have, in the last 6 months, started talking about it more, because I'm just like, why be ashamed of it? It is just anxiety. It is just a thing that clearly I've had 2 children, something's going on. But you've just, I think, for women out there to just be inspired to feel like you can talk about things, and it's not something to be ashamed of or embarrassed about, is just a really important thing. So Lisa, if that helps with your question there, start small, and find a close network, and then hopefully we keep sharing, we keep talking about it. Thank you for those that are still bringing in these questions, and I'm very conscious of somebody. I think this is Dana or Dana, depending on where you are in the world. I hope I'm so glad to hear these conversations are taking place around menopause. I had no idea. I would love to chime in, learn and share. We actually did a live menopause broadcast earlier this year solely on menopause, which might be a good one for you to go and have a look at in our community group, because that was a really good one. But we want to finish up on a question that I think, as Martha had previously said, was what do you feel individuals and or businesses could potentially do to encourage change? Because we've looked now at, there is a lot from diversity in trials. I mean, thankfully, sounds like, Carmen, a lot of the regulatory bodies, whether it's MHRA, EMEA, or EMEA or FDA, they're starting to actually pay attention when they're getting submissions through as to the diversity that's happening with the clinical studies, which is brilliant. That's good to see and encouraging. But even from an individual perspective, what do you think people can be doing to try and help, change? Martha, I'll come to you first with this one.
Yeah, I think educating ourselves is so key, right? So reading, sharing podcasts, going into the community, sharing ideas, sharing best practices among companies of what we can do to increase. So when I think about companies in particular, I think about the notion of psychological safety. And I mean, you clearly feel super safe in this forum. You were so amazing to share.
I know. I don't know where that came from.
Yourself and be courageous. And that's awesome. And so think about workplaces where you create that type of environment where people feel safe to share what they're feeling, what they're doing. This stigmatizing all of these topics that were taboo until like 3 minutes ago, and they shouldn't be, because by sharing resources, by developing toolkits with menopause and perimenopause symptoms and sharing them broadly, you can go a long way. So I think, but the commitment and the responsibility to educate ourselves. When I think about my 3 daughters and think about, we are talking about this at the dinner table every day, and they say, here you come again, Mom. I want them to be able to know what I know. I want them to be able to feel safe to ask questions and talk about these topics. It's the only way to start changing, right? And see potentially, not now, but hopefully soon, some changes in our acumen around these issues. So again, it starts at home, in my perspective, but we all need to be more curious and more be willing to learn and talk about this every day.
Yeah, I agree. Thank you, Martha. I agree. And Erica, what are your thoughts with this?
Yeah, I'd definitely like to build on that. I really appreciate what Martha said. And I'd like to think it starts with the idea of rejecting this idea of normal. It's part of what has made a lack of representation in clinical trials harder for women in terms of getting diagnosed. In fact, in cardiovascular disease, women's symptoms of a heart attack are literally called atypical. These are things we have to reject. We have to reject this idea of normalization. And for me personally, a way that I have been able to use my curiosity as a superpower is to really learn more about people and their experiences. I brought up Henrietta Lacks before. Reading the book about her story really changed my perspective and opened my mind to think differently. And if we can all do that and learn more about the stories of women and others who have gone through life experiences that are different than ours, will help us to reject that idea of normal and be more curious and be more brave about speaking about how we're really feeling. Louise, I also say bravo to you for bringing that up, and also want to recognize that this idea that we have to then explain it as soon as we say
yes,
but we don't. It just is. It just
Yeah.
is, and it's real for us. And so the more that we can acknowledge that for ourselves and for others, I think it leads to change.
Yeah. Thank you, Erica. And Carmen, same question.
Yes, I love what Erica and Martha said. Really resonate with me a lot. I think start discussing about it and start raising awareness is very important, but also considering a little bit our role. For example, I'm representing a pharmaceutical company here, the importance of putting together putting this conversation in a broader group, right? And not in silos, and not speaking on what we are doing as a pharma industry or what the healthcare professional are doing or the patient community. Now, patients are more empowered towards their health, and they are involved even more to their decision. So, for example, increasing the awareness about clinical trials, the way they speak with their healthcare providers. So it becomes a broader discussion, it becomes a multi-stakeholder discussion. So to me, it's very important that we are not siloed in this conversation, but we put together the different players, because in this way we can move the needle ahead,
absolutely.
I think.
And sometimes, as they say, more heads can make a bigger impact than just one. So a team,
especially different perspectives.
Yeah, absolutely. Diversity of thought and different perspectives. Completely agree, Carmen. And we're running out of time. In fact, we're already a little bit over. So I'm going to finish up on our kind of question that we always end, if I can actually find it. It's disappeared, which is lovely. But I'm going to reel it off to you. So what, if you had to go back in time, what would be the best and one bit of advice you'd give your younger self? I'll come to you, Martha, with this one first.
I think that would be own your zone. Practice courage, live with presence. Just do what matters the most to you and have an impact. A positive one, of course, but have an impact.
Yeah. Love that. Great. And Erica?
I would tell a young Erica not to believe everything she thinks, and to really root confidence and the ability to navigate life versus what you already know.
I love that. Thank you, Erica. And Carmen, same question for you.
Yeah, what I would say to the young Carmen, I would probably say shift your attention away from always think about the past and the future, and focus more on the present moment. And when it's a matter of self-kindness and prioritize self-care, do it now, don't postpone it, and don't say I will do it later. So I think that would be my advice.
I love that. I love that. Live in the moment is so important, isn't it? Thank you so much. Some great bits of advice there. And we're kind of 5 minutes over. So apologies I've not got round to everybody's comments or questions, but thank you for keeping the news feed alive. We've got our last podcast that's just been released today. It's our last episode of our 2024 series. So if you haven't seen that land, go and watch that. It's absolutely fantastic. It's a personal journey, and I think that you should be able to see that through the Lift Up community group and our FDI page. So go and take a listen to that. But otherwise, I want to say a huge thank you to everybody that's dialed in, and Carmen, Martha, and Erica. You've been absolutely fabulous. Thank you so much for joining us today. This is obviously accessible now, this recording via LinkedIn. We often see something like 3,000 rewatches and views. So go and distribute it to any colleagues, known associates, friends, anybody that you think would be inspired by listening to this conversation today. I've really enjoyed it, and thank you so much for joining. And until next time, I'll leave you there with our Lift Up community page, and take care and enjoy the rest of your day. Bye-bye.
Bye.
Thank you.